Our next panel will be Claire Olivers, Judy DeVoe, and Bill Ziegler.
I'll go ahead and start since I sat first. I'm Judy DeVoe, and I'm from Cowlitz County, Longview, Washington. That's the 19th district. I'm a retired state employee, PERS 1. I started working for Department of Transportation in 1974. And I retired from the state in 2004, and like an idiot, went to work again and retired again in 2011. Just as the COLA stopped, so I've never received one. When I retired, I thought I was going to be living pretty comfortable. I didn't realize the gas was going to go up every year, the water was going to go up every year, my Medicare premium was going to go up every year, my health insurance premium was going to go up. Everybody is struggling, so they charge the individuals more. My income is still at the 2011 level. Each year now, I have to decide what I'm going to give up if I want to maintain my standard of living. I now have 2 days a week that I have meat-free, but having been raised in a frugal family, I know how to purchase food and make it last well and cook well. But I've also had to give up other things. I looked forward to volunteering. I love helping others. And I decided to volunteer helping veterans. One of my favorite things to do was to go down to the VA Medical Center in Vancouver and help those veterans in the hospital laugh. And I can't do that anymore because I can't afford the gas each week. I have to decide how often I can go to Vancouver to visit my children and my grandchildren. And the cost of my health care continues to rise. I broke my shoulder last spring. I had to go to the doctor every 10 days for x-rays. That's $30 every time you walk in the door. So in a month's time, I was $100 a month just for x-rays. And it goes on. So I appreciate the opportunity to speak today, but please consider helping us. We are vital. Many of us are not as vital anymore, but we need some more income to help us get through our medical costs, if nothing else.
Thank you.
Thank you.
Next. Members of the committee, my name is Bill Ziegler. I'm a retiree from King County local government and under the PERS system. A couple of small COLAs when I turned 66, and then nothing after that. Unfortunately for a lot of us, and I call a lot of retirees on our lists, and I find people that retired in the 80s and 90s. Okay, and one of the problems with retirement systems, and I think people are beginning to realize that the longer you live, the costs actually rise faster than you're able to keep up with. The second thing I want you to realize is that many of our retirees have families with family issues and family problems. They're trying also, within the confines of a kind of a flat retirement system, to provide health care. For example, I have a mother-in-law that's now 90 years old, and she has gone through a small amount of insurance she had for long-term care, but that's over with now. And that means as a retiree, my family now has to shoulder that responsibility and figure out how to take care of that. So please, on behalf of those retirees that I talk to, they do need this money. There are people out there that are really hurting on the pension system, especially our older retirees. So I support this bill. Thank you.
Madam Chair and members of the committee, my name is Clair Olivers. I'm from Everett. I'm here in my volunteer capacity as the legislative chair of the Retired Public Employees Council of Washington. And I want to focus on those, as Bill mentioned, longtime retirees in Plans 1 who haven't seen now a cost of living adjustment for quite some time. As mentioned by staff in the review, if you're at the very bottom, the minimum, receiving the minimum retiree benefit, you've seen modest COLA adjustments because the minimum is automatically adjusted. But for everybody else, no COLA for quite some time now. And many of our more elderly members who've been retired for 20, 30 years, they are having to make the kind of tough decisions you've heard spoken about here on a regular basis and give up the things that gave them joy to be able to cover one prescription or another medical procedure and make a choice between those even from month to month or week to week. So please think about those folks, because in the system you have people who worked entry-level jobs for their entire career, as well as people who had skilled jobs and were paid much more handsomely. So just to be clear, I'm expressing support for all three of the bills being considered, 6290, 6305, and 6340, because any one-time COLA adjustment that you can find a way to make happen would benefit our members who've been without COLA for some time. Of course, a regular and consistent COLA would be the holy grail for us, but we will take anything that you can come up with today. Thanks.
Thank you very much.